Hello everyone, so today I'm going to be talking about facet pain, or more specifically lumbar facet pain, being that that's the most load-bearing area of the spine. Now, that being said, you're facet, so I can give you a visual with my fist. In a way, just use your imagination. The back of the spine is lined by these from the cervical to the lumbar region. So, they actually allow us to lock down in place. Think of a puzzle piece. They fit together. There's two, and there's two on top. And they will, once you're in extension, they will lock back down onto each other and on their articular surfaces. Now, these joints are true synovial joints. So what does that tell us? This tells us that over time, especially with age, they are prone, especially with certain activities over your lifetime, with work or sitting down constantly, they are prone to some sort of arthritis. Not some sort, they're prone to arthritis. Severity of it depends on your life and what you've been doing, obviously. So, that being said, one point I like to make too, if we have facet pain, before all assessments are done, let's say they have facet pain. Most likely, not always, but most of the time, say 85-90% of the time, with flexion, with bending over, which opens up those articular surfaces and allows us like a door almost to open up, is going to relieve some of that facet pain. That's why when you see older people, especially like older, like 70s, 80s, 90s, hunched over a cane or with a shopping cart, that's probably because they have, they have other things going on. But let's, for the sake of this conversation, say they have facet pain. That would relieve them, and then they end up getting stuck in that position, and that's a whole nother story. But that's commonly seen in older populations or people who have these, facet issues. But one test or one assessment I usually like to do with someone who comes to me with lower back pain, who has no imaging done, if they're talking to them about their health history and going through a consultation, I like to have them stand up, where they're comfortable and kind of just lean back. Obviously, I'll have them support something or I'll be right there, but to kind of see if I can, get some sort of idea of what's going on, because as a trainer, I can't do too much in terms of diagnosing and, that kind of, doctorate stuff. I can just assess my clients to get a better idea of what's going on, especially back here if they have problems already. So if I have them go into extension, kind of hold right here, and that reproduces your pain, okay, that kind of gives us an idea, all right, these facets may be the painful area and may be sensitive. Maybe they're arthritic, who knows? Maybe you have stenosis, we don't know. But one other thing we can do to kind of, specifically look at one side and see which side is more, sensitive, is have them kind of extend and laterally flex the spine to one side. Now they might get pain kind of shooting down a little bit. That's more sensitive with stenosis, being that it's spinal arthritis. It's a narrowing of the foramen where the nerves are. So if we have that, it could be stenosis. They just have pain over here where it's more specific and, specialized to one area or one joint capsule area, then maybe it's going more towards the facet pain. I can't say it, I can't diagnose it, and I'm not a doctor, so this is not medical advice once again. But that is one assessment I kind of do to give me a better idea of what's going on in my clients. Now, if they're really old and can't even stand up straight, I just like to talk to them and kind of see and understand and have them verbalize what movements are more sensitive to them or what activities kind of provoke more pain. So you have to understand the context in which the situation can be brought to you, because if it's a younger individual in their 50s or 60s, then you want to see what movements they can do. You want to see how they are in extension. Are they extension intolerant? Are they flexion intolerant? Are they rotational intolerant? Or are they, laterally flexion intolerant? And this will kind of give you an idea of where to go in a process of exercises and progressions, as long as also they need to be cleared. So without clearance, if they have especially prior issues, you need to get clearance. So that's the good thing about my gym. I have the Winthrop Physical Therapy right there. It allows me to kind of refer patients to there, get a good idea of what's going on, and if the images are clear, x-rays, CT scans and all that stuff are clear, and if PT says I can work with them, I can now work with them through progressions that I've learned, from reading and studying and watching millions of informational videos and learning from my mentors. So that being said, this is just a video to kind of get you to see how I assess clients with lumbar, pain, and more specifically, not just lumbar back pain, looking at facet pain and how some tests can kind of be more sensitive than others and give you a better idea of what's going on back there. So my 2 cents. Take with that what you want, This is not a diagnosis. Once again, this is not medical advice. Go see someone for acute care. I can't see you right away until you're cleared. Have a nice day.